Dr. Charles R. Rogers, assistant professor of public health here at the University of Utah School of Medicine. The School of Public Health at the University of Minnesota is one of the top 10 schools of public health in the country. So that was very important to me in terms of making sure that I got high quality training, really getting this training to be able to meet more people where they are and translate my research in a way that I can be in a place of power or privilege such that I can really speak on the behalf of people. So that's why I did an MPH at the University of Minnesota, focused on public administration policy, because I wanted to be able to translate that information not only to lay people, but also to policymakers. For me as a black male, I have a 47% higher chance of dying from colon cancer than a white male. You piggyback on that, and in terms of individuals getting colon cancer before age 50, which was the previously recommended screening age until May of this year, now it's 45, there's been a rise of early onset colorectal cancer, that being colorectal cancer before age 50, since the mid-90s. Funding that I received in November from the V Foundation for Cancer Research is actually focused on developing an intervention to increase awareness of early onset. I am the founder and director of the Men's Health Inequities Research Lab since 2014. I started that when I was a postdoc in Minnesota. It focuses on eliminating inequities in health among men as well as other underrepresented populations. I try to always meet communities where they are, and usually that's barbershops, churches, where guys go over Super Bowl Sunday, whether it be the bar or somebody's house party. You can see me in there educating people. In September 2018, I was funded about $900,000 from the National Cancer Institute from our study called Cutting CRC. So cutting, like cutting hair, hashtag Cutting CRC. And Cutting CRC is focused on developing a barbershop-based intervention on masculinity barriers to medical care to increase colorectal cancer screening completion among African-American men in Utah, Minnesota, and Ohio. When I got the stamp from the National Cancer Institute, which is underneath the National Institute of Health, for that, I was like, okay, maybe I know what I'm talking about. It's interesting that I'm receiving this award, because I've definitely always known I'm a leader, but I just feel like it's so important that when it's my time to pass the baton, that people are there to pick it up. Simply put, cancer doesn't discriminate. And when we focus on colorectal cancer or CRC, which is a preventable and beatable and treatable disease that no one has to die from, I feel like it's my priority, my duty to do something about it.